recording, Katie?
Yep.
Awesome. Thanks. Calling us to order at 9:01. If you could do the roll call.
Yes. Roll call. Uh, Juliet Ballard, Marta Larson, Marie Gress,
Present, calling from Milan.
Margaret Reynolds is excused, Elizabeth Thompson,
Present, calling from Ypsilanti Township.
Jennifer Green is excused, Phyllis Herzig,
Present, calling from Ann Arbor.
Bruce Astrian,
President and calling from Ann Arbor.
Brenda McKinney,
Present, calling from Superior Township.
Allison Foreman is excused, Madden Litton,
Present from Ann Arbor.
Annie Somerville.
Present, City of Ypsilanti.
All right, that is the roll call.
Great, thank you. One note before public participation, Huron Valley Pace was almost not able to come, and so we were going to strike them from the presentation. They are here. They are going to present today. So even though you saw it stricken out on the agenda, they are here, and we're really excited to hear from them. Elizabeth?
Could you remove my Otter notebook
yeah.
from the program? Thank you.
Yeah. All right. All right, public participation. Any members of the public wish to speak to the commission? You can raise your hand. Barbara Neesmay, allowed to talk. There you go.
Good morning, everyone. This is Barbara Neesmay, and I'm the president and CEO of Ypsilanti Meals on Wheels. And I wanted to I thought it might be nice to drop in and share kind of a boots on the ground impact of some of the uncertainty related to the budget, the federal budget, the state budget, and its impact, not just on our budget for serving people, but the folks that we serve. The very short version is that we have about $250,000 hanging in the balance. It's our understanding that it is going to be significantly delayed from a cascading effect of potentially a federal shutdown. And the state has made it clear that they're not going to fill the gap when there is a federal shutdown. The second piece of it is 85% of those we serve live below the poverty level. And we've developed a few scenarios where Medicaid, SNAP, and Social Security are going to be impacting the folks that we serve. And effectively, several folks could be seeing a net loss of about half of their income for the resources that they need to live day to day by FY27. And it could be sooner. It just depends on what resources we can put in place to make sure they don't lose benefits. Been working with the health department, Washtenaw health plan, commissioners, anybody who wants to work with us to try and get this sorted. I'm not laughing because it's funny. I'm laughing because we're all in the same boat. Felt like it would be good for the Commission on Aging just to get that report. Thank you.
Yeah, thank you. Ipsy Seniors. Assuming it's Monica. Go ahead, Monica. You're muted still. Monica? There you go. Hands down. I'm here. I'm hitting ask to unmute. There you go. Good.
Okay. Yeah, sorry, it took me a while to get on. Because according to your website, there's not even a meeting today. But yeah, I want to again thank you for all the work that's been going on about the millage money. I was kind of surprised at how quickly the county got involved and sent out contracts to the senior center, but I still haven't gotten my the money deposited. They keep saying that it's all cleared, but they haven't put anything down yet. So the county is just being terribly slow at some things. And one thing that I've been noticing a lot, I mean, we're still not open. We're hoping to open in the next month. But one thing is that we have an awful lot of people that are just trying to figure out what's going on with the government, with the things they can take care of. Do they have Medicaid anymore? What are they going to have to do? I have a feeling that MAP is going to be horribly down, just deluged with questions once that period comes up. But it might be good that if, especially the senior centers, since those of us getting the money, if we could have some sort of contact, or the council commission get us together so that we could get updated on the latest news. It's just hard for singly, it'd be much easier on the county level to be able to say, okay, this is what's going on. This is what's going on in the state. Because the state budget isn't even taken care of yet, so we don't know what's coming from the state. But that's sort of, just what I was thinking, that it might be something that the Commission on Aging could consider working on. Thank you.
Thank you. Any other members of the public wish to raise their hand and share anything with the commission? All right, we're going to close public participation right before we do public response to the public participation. Katie, could you do attendance for Juliet and Marta, please?
Yes, I can. Okay, roll call for Juliet Ballard.
Juliet Ballard, Dexter, Michigan.
And roll call for Marta Larson.
Present, participating from Northfield Township, Michigan.
Great, thank you.
Great, thank you. All right, Commission on Aging members, anyone want to respond to the public participation? Please raise your hand. We have Elizabeth first and then Annie. Elizabeth, you're muted.
Thank you. I think the idea that was just proposed, being able to have a centralized place to provide some information, of course, things change from day to day, but would really be helpful, I know, to a lot of organizations. And I'm wondering if that might be something that the new Office on Aging might be able to attempt to respond to this task.
You, Annie, then Brenda.
Yeah, I just wanted to respond in both public comments. The conversation around federal and state budget got brought up, and not to I don't. There's nothing that any of us can do to prevent this, but I do believe that we are going to go into a state government shutdown. I'm reluctant to kind of share the details of how the House Republican budget that was voted out last week, how it impacts the folks that we care about, because it's not a real budget. But I'll just give you one example. The House proposed budget rolls back the wage increases that have been put in place since 2019 for direct care workers. There are a lot of things in the House proposed budget that just straight up strike programs. And so I'm reluctant to just share that because it's just not real. Everybody who works with me in Lansing, we're just all kind of shaking our heads because we know that it's not a realistic budget. They were just slashing items to find $4 billion to fix roads. And so I'll try to keep the group updated on things that I think are relevant to conversations here related to older adults if or when eventually we do pass a state budget. I feel really confident in the Senate Democrats that they're not going to cave and fold to really poor decisions that are going to impact vulnerable people, but it's going to be really tough. People who have worked in Lansing much longer than me just like don't even really know what to think because the way that this is being navigated and just the way things were presented and voted out in the House, it just none of it makes sense. So happy to keep people updated. I think the idea of having some updates from each level of government is great. I'm sure we could probably get Zach from Congresswoman Dingell's office, and I would volunteer wearing my other hat as Jeff's chief of staff. Maybe like a biweekly call where we can just have a Zoom and everybody can dump information. Kind of like if you've ever heard of the Park Ridge Park Monday calls. Happy to do that. And then we can get somebody, hopefully, once we have the director, that person can do it. But in the meantime, we could have a county employee give updates from the county. But I'll try to keep everybody updated as much as I possibly can related to the status of the state budget. But to the point that like the federal government might shut down, we might have a federal and state government shut down at the same time. And so I've brought this up to the county administrator because I think we need to have a plan before that happens on how we can prevent disruption in services like Meals on Wheels and things like that.
Thank you, Annie. Brenda?
Yes, I just want to mention to Monica that when we do the reports, the committee reports, the town hall, we were leaning towards some of the concerns that she had. And that's something that we're working on now. And I'll be able to give some reports when it's my turn for comment. Also, I had a question for Barbara. You mentioned, is she still here?
Yep.
Barbara, you mentioned you had $250,000 left. Is that what you have in your balance? Or did I not hear you correctly?
I don't know if, oh, you can hear me. Okay. I didn't know if I was
Did you,
unmuted.
did you?
Can you hear me?
Yes, I can hear
Okay,
you.
yes. No, we have $250,000 hanging in the balance. So our food budget is approximately $500,000.
Mm-hmm.
And we use that federal money October through February, March, so that we can raise money during that period of time to finish the next 6 months. And we typically see a contract from the county via Age Wave
Mm-hmm.
mid-August, and we usually have it signed by the end of August, and we haven't seen a contract yet. We have raised this with the Office of Community Economic Development, and they don't have information. I did reach out to Stephanie Hall Carpenter, who works with us on several aging projects, just to see if she has any information. And and it's not just us. So I've been working closely with all the Meals on Wheels programs in the county, and we've shared some of this parts of this information. Of course, now I'm sitting here thinking, what was in that document that I sent to the Board of Commissioners last month?
Okay.
Essentially, we did say that there was going to be that everywhere we turn, people are saying expect a significant delay. So,
Thank you very much.
oh, thank you, Brenda, for clarification.
Brenda? Bruce?
I know that it's good to hear that Meals on Wheels folks are coordinating, and I was glad to hear Monica suggest that the senior centers do some version of that. Do people know whether, and Annie, you may know well from different perspectives, but do others know whether there's ongoing regular meetings happening within Washtenaw County across the different service categories and providers that are serving as a kind of, you know, gathering place for information and then hopefully a way to share that information? Is there any kind of conscious structural thing going on that is, you know, people could tap into?
Um,
Nobody.
nobody. Yeah, so I know like for transportation, I mean it's a single sector, right? So your question is like multi-sector, but for transportation, we get there's the Michigan Public Transportation Association, and they engage a lobbyist who keeps us updated, and we've been having more frequent legislative update meetings during this time. I would assume that's similar in other sectors. Meals on Wheels America does something like that too, but I don't think anything multi-sector. I think those meetings would be um, really long. Where and then sectors would only get their little bits of information somewhere throughout. So most of the time they're based on the program or service area.
And just one little follow-up. So some of that information is coming from, I know some people are tracking federal, some people are tracking state. Do we know if there's any staff at the county level who's have that responsibility for sort of tracking some of the things? Because I just think that, there's so much going on and we can't track everything. But basic questions or even information, good information as well as the challenging information about what's being cut. We don't know have all the answers yet, but some of that information would be helpful to at least if somebody at the county level um, had responsibility for that.
Annie, do you know of anyone at the county whose primary responsibility is to keep up on the two budgets?
No, we don't have anybody at the county doing that. We do have we have a lobbying firm that represents in Lansing that gives us regular updates on the budget, and then of course me, who gives everybody regular updates on the budget. Um, and we sometimes get updates on federal actions, but usually we just get that information from Congresswoman Dingell's office through county admin. So um, I think to the point, I mean, to this issue, like senior issues, I think it's totally realistic to say that we could pull together a group of people that includes staff from the state legislature like me and staff from Congressman Dingell's office like Zach, where we could give updates. I mean, we also in my job, I get regular updates from the Senate caucus on pending federal litigation that might be relevant. So I have the information kind of at my fingertips from the state and sometimes even federal actions just through my job. But no, I mean, it's really hard to have capacity for something like that at the county, especially when we already pay a lobbying firm who reports back to us on state stuff.
Thank you, Annie. You can't add that to your list of 100 things you're doing?
No, but you know what? If I'm not mistaken, GCSI, who represents us in Lansing, I think they represent a coalition of aging. I wish I could. I can ask. I think I know which lobbyist is kind of the point person in a relative capacity, and so I can see because we could even invite them to give a brief update at one of our Commission on Aging meetings.
Cool. Thanks, Bruce. Anyone else? Response to public participation? Phyllis.
I really like the idea of, it sounds like most of the service sectors have some coordination within them. It seems like this would be an excellent role for the Office on Aging once it gets going to make sure that the different sectors have um, uh, coordination within them and then among them. It seems uh, to me like a very important and significant step and contribution that the Office on Aging can provide. So I hope that's something that can happen.
Phyllis. Anyone else? Great. I also want to say thank you to Barbara and Monica for sharing your comments today. And Barbara, it's really great to hear that the meal sites are coordinating. I know, so I listened to the commissioner meeting and it sounded like some of the commissioners might be open to doing a distribution, and others were hesitant to do that until the director is in place. So I would just encourage the meal sites to continue coordinating and have some ask or plan ready. So if the commissioners are open to a distribution before that person is in place, that might be helpful. All right, so we're going to close the response to public participation. Approval of the minutes. Do I have a motion?
So move.
I have a second.
Second.
All right. Any discussion, edits? Great. If we could have the vote, Katie?
Yep, voting to approve the minutes from the meeting August 1st, 2025. Juliet Ballard,
Yes.
Marta Larson,
Yes.
Marie Gress,
Yes.
Elizabeth Thompson,
Yes.
Phyllis Herzig,
Yes.
Bruce Astrian,
Yes.
Brenda McKinney,
Yes.
Madden Litton,
Yes.
Annie Somerville.
Yes.
Okay, minutes are approved.
All right, moving on to discussion items. The first discussion item we have today is a presentation by Huron Valley Pace. And for that, we have Lindsey. Lindsey, yep, joined us as a panelist. Lindsey, would you like to introduce yourself?
Sure. I'm Lindsay. I'm from Huron Valley Pace. I am the marketing director. I've been there about 6 years, and Madeline invited me to come share a brief presentation as we can be a great resource to anyone 55 and up in the community who meets our criteria. I realized there was a discussion about funding. So far, pace has been okay. I think a big part of that is because we save the government money keeping people out of nursing homes. So, so far, so good. We do have a large lobbyist firm. It's called the Pace Association of Michigan. And Michigan has the third most paces in the country. So we're behind California's number one, New York is number two, and Michigan is three. And then we are also opening a pace in Alpena, and that will be the most rural pace in the country. So kind of some good news on our end that I wanted to share before I do a presentation. And I did, yeah, I got a PowerPoint, so let me.
Yeah, I was just going to ask if you can share your screen or if I
Share.
need to give you that permission.
Let's see. You you might need to give me that permission. I don't see it on here.
Katie, can you make her a co-host as well?
Yes, just did that.
Awesome. Phyllis, you had your hand up for a moment. Did you want to ask your question right now?
Sure. I need just a background of what PACE is, and maybe it's coming. It's just that I missed the understanding of what you've just said because I'm not familiar with PACE, and I'm sorry
Oh.
about that.
That's okay. This will explain it for you. And then I think Yeah, this will definitely explain it for you. I'm trying to make sure I have this in the right format so you guys can see it best. We use Teams at Pace, but yes, this will explain how Pace works, what we are, and kind of go from there. Let's see. You guys can probably see it, but it's not in.
I think where you were
Presentation
on,
mode. When you go to the bottom of the screen right now, next to notes a few over, there's right before the minus sign. You click that. It should be a present button before the minus sign. Yeah, that one.
There we go.
Slideshow. Yep.
All right.
Yeah,
All
it
right.
looks great.
Okay. So, let's go back. So the mission of PACE, our mission is to help older adults live in their homes and avoid nursing home placement. So we do this through coordinating healthcare and support and services. So basically, when I give a 30-second commercial, I always tell people PACE is a nursing home without walls. And I will explain that in a little bit more detail for you. So these are all the services that we provide. Primary care, so when someone joins PACE, we become their primary care provider. They get a caseworker who's a social worker. They may get home care services, which could be anywhere from light housekeeping to meal prep to total care. Nutritional services by a registered dietitian. We have a day center, which is off Ellsworth and Gulfside. Transportation to all medical appointments. Many of you may see our vans. They're probably my biggest marketing tool. Therapy services, so PT, OT, speech. All prescription medications. And all medical specialists. We have optometry, podiatry, audiology, and dental. They all come into PACE, and then other specialists we have to transport our participants to. And this kind of just goes over everything that we do. We also have recreational therapy. So in our day center, we have participants that come in, they may have breakfast, they may do activities, and it's different for everyone. So everything is very, very person-centered. The day center is definitely a place for social opportunities and is meant for a place that many of our participants live with family members. And this is a way the family members can go to work and not have to worry about their loved ones because we care for them during the day and we pick them up and drop them off. If there are times when their loved ones, maybe they don't get home from work till 7 o'clock, we can have a caregiver follow them home on the bus, stay with them till their loved one gets home, and then leave. Or if they live alone and they need help getting home, getting dressed, getting ready for bed, getting dinner, we can do that too. So it's very, very person-centered. I left this on here, even though COVID is still a thing. PACE changed a lot because of COVID, and I think we changed for the better. In the past, we required our participants to come into the day center more and our clinic. Now we do more visits in the home because they don't have to come into our day center. Although it's highly encouraged, and once they do come in, most of them realize how much they love it. It's not a requirement. So we do wellness calls, nurses visits, anything we could do in the day center, we can do in their home, although it's more robust at home. So I always tell people, for example, physical therapy, you can get therapy at home, just like you can with normal therapy services, but we have equipment at PACE. you don't have that in your home. So, there's a difference there. But some people, maybe they have mobility issues. One thing I forgot to mention, we provide all medical equipment. So let's say someone needs a ramp to get out of their house. We provide a ramp. I also want everyone to think if the person is renting, sometimes there are barriers with medical equipment. Sometimes the renter won't, or the homeowner or the property manager won't allow us to put in a ramp or grab bars. Even though we can, there can be issues there. So you just never know.
I have a quick clarification. You said that everything that can happen at the community, your center, your day center can happen at home, but you tell people that a lot of the stuff is more robust at home. Did you mean it's more robust at the center?
Yes, that's what I meant.
Okay, great.
Thank you.
Yeah,
It's Friday.
I get it.
All right. Eligibility. So there are 4 criteria, and this is for all PACEs in Michigan. You have to be 55 years of age, 55 years old. There is no exception.
Or older, 55
Or older.
Okay.
Yep. We frequently get calls for people that are younger. I can't submit a waiver request. The state of Michigan is firm on that. Second criteria, you have to be certified as meeting state of Michigan nursing home facility level of care. So basically, for those of you who have experience working in a nursing home, it's called the LOCD. There's various ways you can qualify. Maybe it's mobility, maybe it's memory, maybe it's oxygen dependency, maybe it's frequent falls, weakness, dialysis, hallucinations, delusions. The list goes on and on. I try to tell people don't worry about that criteria. When we do assessments, we go through a full medical list and questionnaire to make sure we can qualify someone. You also have to live in our service area. So we cover all of Washtenaw and all of Monroe counties, parts of Livingston, Oakland, and Wayne. For example, I live in Heartland Township. That is the northernmost part of our service area. The most southern part is to the border of Ohio, so we're looking at like Temperance in Monroe County. The goal is our service area, it shouldn't be more than 45 minutes to an hour drive to our day center in Ypsilanti. The last criteria, and for those of you who may have a social work background or just a general healthcare background, they have to be able to live safely in the community with a supportive PACE. This is where the area is very, very gray, because what I think is safe, what Marie thinks is safe, what Brenda thinks is safe might all be different. So that is where we have to advocate. The enrollment team has to advocate to say, okay, well, Mrs. Smith may have, let's say she has a hole in her floor in her home, but it's in her living room. So we contact different resources, try to get it repaired, and it is safe. Our caregivers can still go in, but maybe to you and I, we don't consider that safe, right? So different things. I can say one hard cutoff is if someone has advanced dementia, they live alone, and they are now wandering out in the community and can't find their way back home. So those are just different examples of safety. Again, we connect people with resources. I enrolled a gentleman a couple years ago who was in a nursing home, came home, found out all of his pipes burst, didn't have running water, but ran off a well system, so was able to fill up buckets of water to flush his toilets, but couldn't wash his hands or take a shower. So I contacted my resources. We got a plumber out there and we got him some running water. So, again, just we have the ability to be very creative to help make people safe. And this is just common things that help make you qualify, well, one qualify for nursing home level of care. And I will send this presentation and a couple other documents to you to review. Service area, I will give you a zip code list. The state of Michigan approves all PACE service areas through zip codes. The other thing is no PACE in Michigan competes. We do not compete with another PACE. We all service different areas, even though we may back up to those areas. This is PACE by the numbers. This is how many people we, not just Huron Valley, but PACE services. So I did, there are 14 programs, soon to be 15, and some PACEs have more than one day center. So we will be opening a day center in Monroe. The goal is to open it, yeah, by July 2026. Yes, so much need in Monroe. We have a building, but then we have to go through audits, state audits, CMS audits, make sure we have proper staffing. So very excited about that. Here's probably what you're all thinking. Who pays for PACE? So we are paid for by Medicare and Medicaid, or just Medicaid. So if someone is under the age for Medicare eligibility and they have Medicaid, PACE is free. As you know, may or may not have noticed on the eligibility criteria, there's no financial criteria. Because if somebody doesn't have Medicaid, they can still qualify, but they can pay privately for the Medicaid portion, depending on the county they live in. It's between $3,000 and $4,000 a month. Out of the almost 300 participants we have, 3 people pay privately. Very, very, it's not very common, although I'm hoping states like California have a sliding scale for those who don't qualify for Medicaid and they pay a much smaller portion. We're not there yet. But if you think about it, if you're paying $3,000, $4,000 a month, getting all the services you could get in a nursing home, but staying in your own home, still it's a significant savings. But again, the people typically that qualify for PACE don't have that extra amount of money. And this should be Medicaid 2025, but the income limit for PACE Medicaid is $2,901. And that is gross. If you're over that, if you're $3 over, there's nothing we can do. This is one exciting thing that changed this was in February, is for those of you who are familiar with Medicaid, you can now have $9,430 in countable assets, including bank accounts, cash value life insurance. Prior to this, it was only $2,000. Huge, huge change. Very exciting. Was not something done by the current administration, but we'll take it, right? There's more people that will qualify. There's also special asset protections that apply to married couples. I'm not even going to get into Medicaid for married couples because it's complex. But we do have our own dedicated MDHHS specialist who ensure our applications are timely and accurate. And then just kind of gave you phone number to call for enrollment. If you have any questions, referrals, and then there's just a list of all of us that work in marketing and enrollment. Brenda, go ahead.
Yes, I'm really excited that you joined us today. I've heard and I know so many wonderful things, Lindsay, that
Aw.
Chase is doing in the community and also the services that you're providing to a lot of the people that I know personally, how you have changed their lives over the years and they're living, you know, very close to normal lives again. And I happen to know several people who now go to Myers. You pick them up, they go to Myers every day. You have a client who's almost 90 years old. When you first saw him, he could barely walk, he could barely eat, he could barely do anything. And I happen to know his family personally, and his whole life has changed. And you had a seminar a couple months ago. It was on caregivers, and I missed that session.
Oh, yes.
And I heard it was really nice.
We have another one in October.
Okay.
I think it's October. Let me just look at my calendar for you. It's on our Facebook page too, but I think it's either the 21st or 22nd, and that's through a grant. October 22nd.
Okay. Now, your banquet? When you have that every year? Can you let us know when
October
you?
15th. Sorry. Go
Okay,
ahead.
I would like to attend that.
Okay.
Okay.
I will send all this to Madeline, so you guys have all of our documents too.
And I have one last question. I read that where they're going to build some housing next to Pace. Can you explain that to us? What is that all about?
The goal, because we own some property where Pace is located, kind of towards the back, where you can't see it from the road and the side. I believe I don't know the amount, but it's the goal is to build some affordable housing with I believe it's the Ann Arbor Commission, even though it's in Ypsilanti.
Mm-hmm.
So that's a couple years down the road, but yes. As you guys all know, affordable housing, even though we have resources in Washtenaw County, we don't have enough affordable housing.
Right. Okay.
Yeah, I
Well,
think, I just wanted to add, because Ann Arbor Housing Commission, they could build anywhere.
Okay.
I think Pittsfield Township doesn't have a housing commission. So that's
That makes
why.
sense.
Yeah.
and if you read the article, it sounds like they're hoping that a lot of your clients from Pace will be able to use that housing. Is
Yep.
that what I'm reading? Am I reading that correctly?
Yes.
Okay. 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 That's a good thing. So I just keep up the good work, and anything I can do in the community to support you, just let me know, because you guys are doing a fantastic job.
Well, thank you.
Thanks,
I
Brenda.
okay.
Marta? And then Bruce, I see you next.
I was interested in your slide about the income requirements for Medicaid, and you didn't share any information about income requirements on Medicare, and I'd be curious about that.
So Medicare, typically there aren't any income requirements. You qualify for Medicare through age or I believe end stage renal disease, or disability. Those who are disabled qualify for Medicare. I always think of Medicare is more of an age requirement. Medicaid is those that need aid, those that need assistance. Medicare is federal, where Medicaid is part federal and state funded.
Well, I understand the difference between Medicare and Medicaid, but I'm just wondering if someone is on Medicare and would not qualify for Medicaid, would they be able to use your services?
So yes, they could, but they would have to private pay the Medicaid portion, which is between $3,000 and $4,000 a month.
Thank you. That's what I wanted to know.
And Marta, it depends on what county they live in. So we service 4 different counties. So that's why I wanted to give you that. It's a slight difference, but I don't want to give you wrong information.
Yeah, thank you.
Bruce?
Thank you, Lindsay. And I can't really add much to what Brenda said about how what a fabulous job you guys do. I wish there were PACE programs for everyone who needs them. The question I have is, you mentioned that for the moment you're okay on, you haven't felt the impact of what's happening in Washington in particular, and obviously because it is a state partnership. But all the projections are pretty dire. And even organizations, you noted that even organizations that are known to save the government money are being impacted. It doesn't seem to be, a particular point of interest for some of the people making these decisions. So my question is, as you look down the road, and no one has seen the final budget for the, coming up in the fall for the federal government. And as Annie mentioned, we don't even have a sense quite yet of what the state budget looks like. But people are playing, I mean, to say they're playing hardball would be an understatement. And I guess I wonder, are there other sources of for you other than Medicaid and then whatever people, can pay individually? Is the state contributing any additional dollars, or do you have any plans in case you guys start to suffer really major cuts?
Good question. I don't know I can answer all of that. We are so basically, in a nutshell, Medicare, I'm just going to throw out a general number. It gives us 4,000 a month per participant. Medicaid may give us 3,000 per participant to cover all of their care. We haven't seen the impact or the final budget, like you said. It doesn't appear that we're going to be impacted. The hard part is, are we going to get an increase? I highly doubt that. All PACEs in Michigan are owned by a nonprofit. So we're owned by Brio Living Services, formerly United Methodist Retirement Communities. So I'm not sure what exactly their plan is in case of funding cuts. But that is definitely, they own 5 different PACEs. And, they also own some private pay assisted livings and independent living, affordable housing. So I'm really hoping we're okay. Again, the PAM Association of Michigan hasn't really given us any reason not to believe that, but who knows, right? Like,
Thank you. Bruce, did
you're
you have
welcome.
anything else? Great. I have a couple questions, and then Brenda, I see your hand next. I had some clients when I worked at the Milan Senior Center who used Paste, and they absolutely loved it. Could you give us some reasons why Pace hasn't worked out for some people aside from the financial costs when they have to private pay?
So one of the biggest barriers is, and I can probably go back on this so you guys can see, for those who enroll in PACE, one must change their primary care physician to us. Those who have a really great relationship, they can still see their primary care twice a year for a wellness visit, but we have to manage it. So we use Dr. Almeida from Michigan Medicine, who's a geriatric physician, and then we have 4 nurse practitioners. But that would be one of the greatest barriers, is changing your primary care. Also, we contract with several specialists, all of them at Trinity, IHA, and Michigan Medicine. But let's say someone has an oncologist with Henry Ford. We can reach out to that oncologist to see if they want to contract with us. But if they don't, that person would have to get a new oncologist. So those are reasons. Another barrier is if the goal for PACE is for people to remain in their home as long as they're safe. If someone comes to us and says, I really want to live in assisted living, I don't want to live at home anymore. That's another factor. We do place people in facilities, but again, that's not not in the beginning of their enrollment. We want to keep them at home as long as possible. And that's what most people want, right? That's what I want. And I've worked in facilities. Even people in facilities want to stay at home, but sometimes you can't.
Yeah, thank you. Is there
You're
a
welcome.
wait list for your program in Washtenaw County?
There is no wait list,
What
but
would, oh, okay, go ahead.
enrollment, you cannot enroll in our program till the first of every month. So right now it's the 5th. If you want to start PACE and begin the assessment process and you qualify, you can't start till October 1st. That's set by the state of Michigan.
Right. So when you say start the program, could they be filling out their paperwork and things before September 1st, and then September 1st or around there, or October 1st would be when your assessment with them happens? Or do they have to wait on all of that until
Nope.
the
We
1st?
can start the whole assessment process prior.
Oh, okay.
Our biggest barriers are if they don't have Medicaid, applying for Medicaid, because even though we have a DHS specialist and we can get their application in quickly, we can't go get bank statements or life insurance statements. We can request them with their permission, but oftentimes there's delays. They take time, or their asset detection comes back from Medicaid. They have a bank account that they didn't know about that has a balance in it, so we have to figure that out. Maybe they have life insurance they didn't know about. A lot of seniors get scammed into buying these crazy life insurance policies. Yeah.
What kind? What kind of, like, for
These
example?
infomercials that are on TV late at night, like on
Uh-huh.
local channels.
Right.
Those,
The
and I'm like,
$9.95 a month or those? Okay.
and they'll say, but I'm leaving that to my granddaughter. And I'm like, but you can't buy life insurance at 80. It's not going to mature. They're never going to get the money, no matter how many times you may tell them that. Or, for example, I shared you can have $9,430 in the bank. Well, this person has 13,000 and they don't want to spend down. But they have no other services. They need all of the help at home, but they're like, I've saved this 13,000 for 30 years. I'm not spending it.
Wow.
And sometimes they may take it personal, like it's me or it's the enrollment coordinators. We're just communicating the message. There's ways they can put money in for a funeral, so their funeral is paid for. There's ways we can help them, but again, we can't hide assets.
Right.
Yeah, those can be barriers, especially, I don't want to tell someone they have to spend 3,000, even though I go to their home and they need a new bed, they need a new TV. They could spend that very quick. They're just not willing to.
Right.
Another thing I always discuss is PACE is a wonderful program, but it is not a program in an emergency. So if your loved one has fallen, broken their hip, they're now in rehab, and they get home on the 30th of October. I can't get them enrolled by November 1st. There's too many assessments and paperwork, and maybe they don't have Medicaid. So I always tell people PACE is something you need to consider and plan before it's too late.
I have a few more questions. So you said there's no wait list right now. What would be the capacity of your program? Like, do you have room for with your current team? Like, do you have, room for 10, 20? What is that like?
Right now, so we have 295. We have room for 360. But
Wow.
think about this. Because we're over 10 years old, we have a lot of participants who pass away every month. So even if we enroll 10 people, we may have 5 pass away. So
Okay.
yeah.
Okay.
Yeah, and we can get that cap increased by the state too. The Monroe Center will have capacity for 150.
Oh, that's great.
Yeah.
Um, when I was working at the senior center and we had some clients using PACE, some of the things that they really enjoyed was that, if they needed assistance taking a shower, you had showers at your day center. Or if they needed help with their laundry, the person who came to pick them up would come into their
Yeah.
home, bring the laundry from their apartment to the bus, and then your team would help them with their laundry. Are these still opportunities post-COVID?
Oh yeah. We do a
Awesome.
ton of laundry.
Yeah.
Yeah,
Yes.
it's
And
huge.
showers, so
Hmm.
many homes aren't safe to bathe in.
Yep.
Maybe they have a bathtub like myself that you have to step up into, and
Hmm.
that can be dangerous. So some people just come to our day center twice a week to get a shower or to take it on their own. We have like 6 or 7 shower rooms there.
Wow. Wow.
You also, I remember when I toured the facility, had an additional, at the time it was at least a curtain that was an additional space for people with dementia, so they could still be at the day center and enjoy the programs, interact with everybody else, but that curtain acts sort of as um, a wall, the way that someone with dementia, their brain processes information like that. Is that dementia space still there too?
We have a whole unit. It's called the Jeanette Day Center, and
Mhm.
it's a secure unit for those with more advanced dementia and memory issues. And then now the curtain area we have 2 beds there. So if they want to take a nap, they can take a nap. If they want to engage, they can engage, or we have a greenhouse they can sit in. Yeah, a lot of the participants with advanced dementia come 5 days a week because there's a lot of caregiver burnout caring for someone with dementia.
Hmm. Yeah.
One more. I would love if you could talk a little bit more about your transportation program. You mentioned that you do medical transportation, and so I'm wondering if when you do those medical rides, if um, the driver or someone else is going with them in, like bringing them into door through door service is what I'm asking. Bring them into their doctor's appointment, and then do they wait there with their doctor or something else? And then the other piece of transportation, I'm wondering, so I remember this individual had um, the driver came in to get their laundry and all of that. Is that door through door service like something that you just offer everyone all the time?
Yes. So, the first part with appointments, let's say they have an appointment with probably their specialist, and it can be overwhelming, and they may need someone to take notes, or their family might want to meet them there. So we can have either Sina ride with them on the bus, take them to the appointment, be there. We can have a family member be there. Um, that all depends on the person, but absolutely. Typically, depending on the case, the driver doesn't wait for those appointments. They give the receptionist at whatever unit a card that will say pickup time here on Valley Pace, and we'll give a time that we'll pick them back up. So they're not sitting in the lobby saying, "Oh, I maybe Pace will come get me." Um,
Right.
and our transportation, for those of you who don't know, they're contracted employees. They're by Emergent Health and Huron Valley Ambulance. So
Oh.
many of our drivers are either semi-retired
Hmm.
or students or EMTs that are just looking for extra hours. On
Hmm.
our participant satisfaction surveys, our drivers get the highest satisfaction. Everybody loves them because if you meet them, they're the most friendly, bubbliest people ever.
Hmm.
I wish I could have them on my marketing team because they're wonderful.
Yeah.
Thanks for so much for answering my questions. Brenda and then Madden.
Um, Thank you so much, Marie. Um, Lindsay, how many vehicles do you have?
I want to say it's 15 to 20.
Okay. All
We
right.
own the vehicles, But Huron Valley Ambulance Emergent Health is the drivers that, and they maintain them.
Okay.
We also contract with other transportation companies. So you may have seen, we use like a service called Mamadou, A Ride,
Okay.
Reliable, and that's for more, maybe it's more of an emergent visit, or maybe we don't have a route going to that person's house,
Oh,
but we don't want to delay services because of transportation.
got it.
So
Mm-hmm.
we do, if someone's in the hospital and they're discharging, we want to make sure we can pick them up, or maybe A Ride can, just depending on the issue. We don't want to keep someone in the hospital because of transportation issues, right? So, the other factor too, we do go shopping with participants, but our caregivers can't take them in their personal car.
Oh,
So we have to meet them at the grocery store.
okay.
Some type of insurance liability issue that changed over the years. So we're
Okay.
more than welcome to do it. We just got to get a little creative with it.
Right, you make it work. Yep.
We make it work.
And I have one last question. I have met several of your clients who received Medicaid, and they have shared with me that they have their services and has changed with Medicaid. How how are you, how is PACE making adjustments to those changes in their Medicaid services?
So some of the biggest changes we've seen, so during COVID,
No, I
with
mean,
their,
just since recently, since the federal government made these
oh,
changes.
you know, maybe so there's several, and God, what's going to happen in open enrollment? But that's a whole different issue. But there's several Medicare, Medicaid programs that may give lower income seniors, they give them like this stipend that
Mhm.
has been cut off.
Right.
If someone has that program, and let's say they get 150 a month in it's like a Visa debit card,
Mhm.
and that's cut off, a lot of times they'll want to enroll in PACE because you can't have two government programs at once, right? Government says, we're not going to pay for you to get this program and PACE.
Okay, got it. Mhm.
So those people may use PACE. And a lot of times we explain, although you're getting $150, you would spend more than that on your medications, on your incontinence supplies, on your meals. But some people, like, cash is king, right? Like, I
Mhm.
get it, but it can be a hard sell. Another instance is be after COVID, the extra money people got on their food stamps, their FAP,
Mhm.
that got
Mhm.
cut. So people thought, oh, PACE is cutting my food stamps. No, we didn't cut them.
Okay.
We work with food gatherers, so
Mhm.
that our participants can do shopping for fresh produce. But then we also send home frozen meals. We
Mhm.
use Thomas's Catering for our participant meals.
Mhm.
They're really good.
Mhm.
They prepare all the meals. They bring them into PACE every day. We serve them. And then the extra part that we order, we package and freeze so people can take home.
Okay.
Um, we also work with Ypsilanti Meals on Wheels, Ann Arbor Meals on Wheels.
Mhm.
Um, we nutrition is huge too. So
Okay.
that's a
So you
part of
make
it.
a you're making some adjustments for them
We
with
have to.
okay.
Yeah.
Okay, thank you. I'm so excited and happy
You're
you're here.
welcome.
Maiden, thank you so much for bringing Lindsay to speak with us today.
And we've been talking to Maiden a lot too, because you're one of our eviction specialists. So um,
Mhm. That's right. And what would you like to
sometimes,
say?
yeah, that's very important resource for us too.
Yeah, absolutely. And I wanted to say I wish more of our clients could get into Huron Valley Pace, but you do have to be housing secure, and so that they can set up the care in a productive way. But that's definitely a barrier on our end of being housing secure. But love the work you guys do, and thank you so much for coming, Lindsay. This was a great presentation.
Oh, you're very welcome. Thanks for having me. Maiden, do you want me to send you the slides and everything so you can share with everyone?
Yeah, we can do that. Let's,
Okay.
yeah.
Can we get your number too, Lindsay?
Oh, yes, you may. Do you want it now
And I
or do
can
you want
share
me to
your information as well.
Okay,
Okay.
I'll
Yeah,
share.
Thank, thank
send
you.
your contact information to Madden and she'll send it to myself and the staff so we can send it to everybody. We don't have a chat feature in the Zoom, so you can't put it
Thank
there.
you. Thank you,
Mhm.
Marie.
Yeah, yeah. All right. You could if you could stop sharing your screen.
Sorry, I tried to stop share.
Yeah,
Okay.
thank you. And thanks for joining us today. You're welcome to stick around and listen to other things we're talking to, but I'm sure you have a lot of other things on your plate, so we're not offended if you dip out.
Well, thank you for having me, everyone. I will share everything with Maiden, and then she'll share with everyone here. Have a good Friday and a good weekend.
Yeah, you
Thank
too.
you.
Thank you.
All right, up next is our subcommittee discussions. First off is communications, and I didn't receive any. Madden, did you receive any? Nope. All right, moving on to future planning. Did that group have a meeting this last month?
We did not have a meeting, and I was hoping we were going to have one, but I had a number of personal things that made it hard for me this time. But we will have one in the next few weeks.
Great. Town hall, did you all have a meeting?
Well, yes, we have. Bruce and I have had a meeting, and we're gonna, as soon as we get things finalized, we're gonna contact Allison and Maiden and get their input. But back to what Monica was talking about, was Medicaid. And what we're hearing so much from the community that their Medicaid, like I mentioned to Lindsay, their Medicaid services has been changed or cut or something. And no one seems to know, can explain it to the individuals why their Medicaid is having changes to their Medicare. So Bruce and I were thinking, and what we're looking at is getting someone from the federal level maybe to be able to come and share some of the concerns and answer some of the questions. Right now, we're looking at securing a place at Second Baptist Church on Hamilton Street in Ypsilanti, and that was something Pastor Waddles was interested in. So as soon as we pull more information, get secure people and things like that, we can bring the information back to you. But right now, we're just in the process, and these are some of the things that we're hearing from seniors that they want to know about their Medicaid changes. Bruce, did you want to add something to that?
Well, only that Brenda did a lot of legwork and reached out to a number of people, including Debbie Dingle's office and others who, you know, were interested in trying to be helpful in pulling some people together, specifically around this confusion, short term, and it's probably going to go on for quite a while, unfortunately, but this confusion around Medicaid and the cuts and what that means, and the fact that Brenda had reached out because she was hearing from so many people that some of the impact was already starting to hit, even though technically some of the changes aren't supposed to be happening yet. But I
Right.
think that's true of a lot of things that are in the sites of the various cuts and changes. So we haven't pinned down a date yet. We talked about sometime later in September. Brenda has, as she mentioned, secured a potential site for this. And I don't know whether others are anecdotally hearing from other people similar things, but this was specific, very specific to the Medicaid changes and cuts.
Mhm.
Right. If you need an additional person to speak at this town hall, I've done work with MAP, Medicare Medicaid Assistance Program. They oversee all of the sites, which are mainly the area agencies on Ageways, like our Ageways here.
Mhm,
The
mhm.
area Agency on Aging, like our Ageways here.
Mhm.
But I've done work with them, and I'm happy to connect you with their executive director to see if they can send someone out there. They
I
often
would
are the ones doing the updates to the area agencies.
I would
Would that be?
appreciate that.
Yeah,
I would
yeah.
really, you guys, I am hearing and seeing so much about Medicaid, and like Bruce just mentioned, it wasn't supposed to start right now. Why is it happening to our seniors now? There's no answers for us. There's no one there that can tell us anything.
Mhm.
I was in CVS just the other day, and a lady, she was a senior, she was in tears. She said she just got cut off of Medicaid, and she said because she made too much money. She worked in retail. She's 77 years old. So these are the kind of things I'm hearing in the community, and people want answers. So I would really appreciate that information,
Yeah, yeah,
Marie. Thank you very much.
yeah. Thanks for your work
Marie,
on that.
quick question, Marie, is the MAPS folks, are they part of the state program, or is that more
Yeah, so Michigan's Medicare Medicaid assistance program is broadly overseen by MAP Inc. And they're the ones who oversee all of the programs that happen, open enrollments, as people age into Medicare, all of those things. But they're like the administrative piece, whereas the area agencies on aging and other community partner sites are the ones who do the individual registrations, meetings, community education, and things like that at the
Mhm.
super local level. So for this much broader piece that you're talking about, I think it would be helpful to have, yeah, that state
Okay.
level piece, because they could talk
Yes.
about the state impact and the federal impact
Right.
as it's
Right.
happening. Yeah.
Right.
I think it would be great to have that person. I was just wondering that there's an 800 number that you can call at the state
Yep.
level. Is
Yep.
that
That's
part of
that
that?
number.
Yeah. Okay.
Mm-hmm.
Well, we want that. Thank you.
Mm-hmm. Next up is the millage work group. Did you all meet? Are you still meeting? Do you still want millage work group updates?
We have not met, and I don't know the answer to that question. I don't know if anybody else on the group wants to respond to that.
Only that three of us, Juliet, Allison, and myself, were part of that review committee for for the transportation grant, and that was the only connection to the work that Marta and others have been part of. So, I don't know, we haven't quite decided what our role is going forward, but it's at least that was one piece that was continuing.
Mm.
I'm wondering if you could, I don't know if you want to share now or if you all want to discuss it and bring this back, but seeing as the Commission on Aging will have members
I
involved
think it might
in.
be a good idea to have a quick Zoom meeting of the group of us, and we'll come to a conclusion and then report back. Does that sound okay to everybody else?
I'll report back on what subject was that? I'm sorry. Marie
Um,
was,
the millage work group.
oh, okay.
Mhm.
Whatever. I'm easy, whatever one wants. Oh, Marta,
Yeah, you
thank you
guys
so
talk about
much.
it and see if you want to continue doing updates. But my question for the three of you who are on the review committee is, seeing as the Commission on Aging is going to be part of that process going forward, any feedback you have on that process would be helpful for the office to hear or the director of operations to hear. I don't know if you're comfortable sharing any of that now or if you want to talk together and report on that next month, but I think that would be helpful.
I know Allison's not here, and Juliet can speak for herself. I mean, I thought basically the process was quite good. It was a little confusing at the end, when it got really, I don't know what happened at the commission meeting. I wasn't able to attend that, but and I didn't quite know what the resolve was. I think there's some things that are still up in the air, but I thought that the overall discussions between the five of us who were reviewing the proposals was very well done and more or less a consensus. And Juliet, I don't know what your thoughts were.
I thought it went well. I think that I would have preferred to have more closure at the end of what the results were. Um, I also I don't know what was presented to the people that were submitting them, but some of the questions that were presented that Allison and I responded to were in the actual proposals. So I think that sometimes questions were asked that the information was there, and we kind of had to make sure that everyone understood what was there. So I don't know if there initially is a discussion about the proposals uh, overall, and then the scoring could happen, and then have a meeting to discuss it as a group, and then know what the results are. I think the people that were reviewing them should know what the results are prior to them going to the commission or the recommendations, so that the people that are actually reviewing it feel as though their input was heard or that they were active participants. Because we had the discussion, but we didn't have closure about what the outcome was. And I don't know if that's possible in the process. It just seems like it should be. Um,
And I'll just add, I agree with your Juliet's comments. It got a little confusing at the end, and the overall process and scoring plan for this particular proposal was not ideal. It was confusing in parts, and we were fortunate that there wasn't 25 proposals. We were able to sort of make sense of the four proposals we did have, even though the scoring system was kind of working against us at times. And so I think they need to improve that. And I do totally agree with that they need to improve the final stages of this. And I understand it's complicated in that it gets handed off after we've done our work to the Board of Commissioners, and they have their own thoughts on things and make modifications as they see necessary. But it was kind of left in the air a little bit.
I also feel that the people maybe that are doing the scoring should be not have a conflict, but be aware of what's available or the system, or have some background knowledge of what the community depends on, what the structure is as it exists, what's being presented, how it would impact in the future. I think all those things are very important. So if you're I'm just saying this vaguely, but if you're on a call with a group of people and some people don't have the background knowledge, their outcomes may be contradictory to what would serve the community the best. You know what I mean? If they don't even know what certain things are, you know, what the transportation system is like, that, or where they go, or do they go there, or do they go, just some kind of foundational knowledge, so we're not picking over those things and losing sight of what really will impact our community. Because to me personally, and as I said, the wrong decision could be catastrophic. You know what I mean? You can't change things so suddenly. And you have to have a little bit of a heart about it. You're
Hmm.
talking about seniors, you're talking about switching everything in a direction that seems economical, but at the end it's going to be catastrophic for our people.
Right.
And I also think that across the board with all this money that's getting, I'm going to get off my soapbox in a minute, but all the money was given, and at least I know when I voted for it. I thought it would either make sure that we had things still in place that have been in place,
Mm-hmm.
and at least we have those things, and maybe a little bit more.
Mm.
But to think that I voted for it and then I'm going to lose basic staples,
Mm. Got it.
how are we going to explain that to the community? And that's what I said to the group. And then everyone was silent. So I'm going to be quiet because you guys are silent too. Maybe when I
No, what you're saying makes, I
I,
mean,
yeah,
it
all of
makes
this feedback
sense.
is so
Right.
good.
I was like, oh my God, maybe I'm saying too much.
No,
I
No,
just
it's
feel
no.
like
great.
we have to
Could
have
I jump in?
we have to
Yeah.
have some integrity in what we're saying and what we're doing. And if we're doing asking people to give more money, seniors, and pay more taxes, and then they
Mm-hmm.
turn around and we're in a group deciding to swipe some of the things that they depend on and have depend on for years,
Right.
problematic to me.
Could I jump in just to get some clarification? So just to be clear, like the county, we never funded like a majority of the funding that's going to go out through the millage are things that we've never funded before. And so I'm a little confused at the conversation around like things that had been in place. We obviously didn't anticipate when we decided to put the millage on the ballot that Trump would be our next president and there would be huge cuts at the federal and state level. So I just want to get some clarity. Like the Board of Commissioners never funded older adult services. The millage is providing millions of dollars annually for us to be able to push out into the system. But from my understanding, organizations that are having impacts and making cuts to things, it's due to federal funding cuts. And so I just want to be clear that when we're talking about the millage, that the county, the Board of Commissioners, we are not cutting funding. And when we're going through the RFP process, regardless of what's happened at the federal level, the decisions that we're making at the county to fund in no way are cutting services because this is all new money for us. This has never existed. And if you look at the data from like, I think a couple years ago when I first got on the Commission on Aging, I shared how little the county actually spent older adult services. And so the reality is, however you look at it, there are cuts at the federal level, but from the county perspective, we haven't cut anything. We're not choosing to end any program. These are all outside external programs that are having to make hard decisions because of federal funding losses. And so I don't want the things to get crossed and make it seem like we got this millage and now there are decisions being made by the county to cut things. That's just not true.
I didn't want to give that impression, and I did say that to the group. I'm saying that if there are things that need shoring up because of the certain circumstance, that I think that those things maybe should be considered first. And since
Yeah,
they're
I hear
staple
that.
to our community, I'm not implying that you guys are going to cut out, but I'm just saying that if people are voting for it, I think they would expect to just have their at least the base services that they have had amid the financial crisis. So is
Yeah, I
that
guess it just gets a little confusing because, like, so far we've put out excess dollars to make sure that we fill gaps that Food Gatherers is experiencing for food pantries for older adults. We put more money into the SKIP program. We will be putting more money out into the nutrition space, both to expand but also to fill gaps. And so I guess, like, I'm only getting a little sensitive around this because I don't want that to start being the messaging. Because any way you look at it, we would be totally screwed if we didn't have this millage right now. And
Yes.
while we're going to be playing kind of, in emergency mode for the next couple of years, at the end of the day, like, I don't even want to think about how older adults would be impacted if we did not have the millage at all. Because when you look at our county budget and you look at our mandated services, serving older adults and all the programs that will be funded under the millage isn't a mandated service. We had a really good presentation the other day, even though I believe it's a mandated service under the state law and federal requirements. Nope, it's not. But funding, cops and courts is. And so I just want to make sure, like, it's not even been a year yet. I just don't want it to start being out there that, like, we asked the voters to do this thing and now the county's going back on what it was intended to do. The whole intention was to expand services. None of us knew that there was going to be so much chaos right now with federal and, quite frankly, state funding. And so I'm not.
Amen.
We understand that, Annie.
I'll say
We're just
amen to
passionate.
that. We did not know.
Well said. Well said, Annie.
No, we did not know. Mm-mm. It's
A few
crazy.
questions for you guys, it looks like. Phyllis, then Elizabeth.
Um, so I first I have to clarify that the um, uh, proposals that you were talking about, Bruce, these are the request for the RFPs that have come about transportation. Is that right? I'm trying to figure out where the the operationalizing of the millage is happening. I know that some funds were allocated for senior centers. Apparently, they haven't gotten there yet, but that's one thing. And then the RFPs were to start. Uh, and so I want to just clarify for myself if that's where we are. And also, my other question is about the what's happening for hiring the director of aging services.
We can get to that director update with Annie's report from the Board of Commissioners. I
Okay.
think sticking to the RFP process feedback is where we should stay for right now. And Bruce,
Mhm.
that question was directed at you, so I'll turn it to you.
Yeah, I think you actually made the distinction, Phyllis. Some monies were given out, including the monies to the senior centers. The only RFP that I'm aware of and that we were involved in was regarding the transportation monies. And so that process was, as I said, I thought it was handled relatively well, especially, quickly. Um, and we were able to look at the four proposals. And I think where it got a little confusing at the end was there were some follow-up questions, and I don't quite know how those all got resolved, to at least three of the four organizations that we voted for awarding money to. And then all that whole package of recommendations was brought to the Board of Commissioners, and they had their own questions and their own thoughts
Mm.
on that. And I think I think it was um, handled relatively well given the circumstances. I do agree that there was this kind of lingering confusion, but I think Annie's point is a really strong one that
Mhm.
people need to understand that there really are kind of two tracks this is all working on. One is kind of trying to respond as thoughtfully as we can to some of the emergency and critical stuff that's happening. And I think that's where a number of the initial monies that went out of the millage fall into that category. And I still think there's a desire, once the person is brought on board to head up the new agency, to work together to figure out longer term what we want to do, not only with the millage money, but other things. So I think that's where the messaging probably going forward needs to be, yeah, we're responding as best we can to these critical things, but we also are keeping in mind what the original intent of the millage was before, way back when in November when it got passed. Unfortunately, it got passed the same day that federal government changed hands. So uh,
Wow.
that's where we are.
Responding to a comment from Annie, to keep um, the understanding more clear, I think um, that the publicity around where money is being allocated is going to be very important, so that if as we thought, the millage would pay for additional services. But I agree very much with Juliet that we have some very important services that have been going on for a long time. And if the funding to those services is lost, then we've lost our foundation. So I think we have to be sure to tell the public that um, money, where the money is going and why. If it's going to pay for something that has been ongoing, and then the whatever additional services can be provided. But I I think it's really important for the public to learn the consequences of all of these cuts, that what we've used and depended on as foundation of services, if they're cut, it's it, it's voter responsibility, and voters need to know that. So I think we, as a commission and the Board of Commissioners, have a responsibility to make sure that the general public learns uh, the consequences and how these funds are being used. I think that's
Phyllis.
for now.
Can I respond to that?
Sure.
So I'm not trying to sound defensive, but we talk regularly at our board meetings on how the federal budget impacts are affecting not only county services, but our partners external. In our community, we operate a human service system that is majority external, a lot of funding that we pass through from the state and feds, and sometimes through county grants that we support. But I think some of our organizations, especially in the older adult space, are doing a really good job at explaining to their users and their mailing lists, and on social media on how the cuts are impacting them. And I think at the same time, we are talking about that regularly. And I'll say this because I've been trying to be as transparent as possible, not just in the older adult space, but in the human service space broadly. People cannot expect the county, like we are not going to be able to fill all the gaps from the federal and state funding losses. And nor is the senior millage. And I've said that from the board table at least once or twice because I don't want people to think that we can do that. It's just not possible. Even if yeah. Anyways, I'm not trying to sound defensive. Communication is always a challenge because it's hard to know how to communicate effectively with people. We don't know who's looking at our board meetings. We don't know who's paying attention to press, which I know that we've had many press articles on some of the funding distributions that we've already done where we've talked about federal funding loss. It's hard to know who's talking and who's listening to that or seeing it. Soon we should have an Office of Aging, and hopefully that will be the first step in a more strategic communications plan. But every chance I get from the board table, I talk about how federal funding or lack of federal funding is impacting a number of services, especially older adult services. And it's been a huge talking point in some of the deep arguments we've been into at the board table too. And so just sharing that, not to be defensive, but in some ways a little, because I've been saying this publicly as much as possible, and I've been trying to be transparent about what capacity the county and the millage even has to fill some of these gaps.
Thank you, Annie. I didn't mean to make you defensive. That was not my intent at all. And thank you for your advocacy and all the work you do for the senior sector. Thanks.
Elizabeth?
It is absolutely true that the county can't fill all the gaps that are left by cuts in federal and state funding. And I think that I'd like to underscore what other people have said, especially Commissioner Somerville, that that's a key message to get out. But sometimes members of the public don't always hear the messages we're getting out. And I do agree with Juliet that there is a concern that people will see it as problematic that some services are being cut in a particular space, such as transportation, and new surfaces are added elsewhere. That is going to happen because funders are having to look at everything that's being provided and decide what is essential. And certainly we've all made recommendations back before expected these cuts, the real needs to have surface expansion. So I would just suggest that as the RFP process goes forward, that we all very much focus on the messaging, and also that as the process gets more developed, as more RFPs are submitted, that perhaps one of the criteria that might be looked at in the discussions around the funding is what of the RFPs that are submitted are to shore up existing services versus what are expanded, and consider that in this totally new environment, we have to consider both. Because sadly, what we had hoped to have in the beginning of November, which was surface expansion, isn't always realistic these days. So I agree with Commissioner Somerville and the other comments that we need to make this difficult situation as clear as possible in our communications.
Thank you. I had another process question. You had mentioned that you received the proposals and then you discussed them, and then the scoring happened after that, and the questions to the providers happened after that, and then you weren't sure how it exactly ended. Did I hear that correctly? Is there anything more you want to add to that process?
The only thing I can say is that we got feedback. We did get some feedback from Brady. And then he presumably was taking the feedback. Well, he was taking the responses he received, or to the extent that he did receive them, from the three organizations that we supported. And then that was being handed off to the Board of Commissioners as far as we knew. And I don't believe, Juliet, you can correct me if I'm wrong, but I don't think we heard anything since then, have we?
We haven't heard anything, and we kind of were waiting for responses from the organizations then come back and further our conversation. But I think it went directly to the commission. I'm not sure. So we don't know what the outcome was or what decision was made. And like I said, I think some of the questions that were asked were questions that, if you're aware of what's going on in the community, we would have already had the responses to those. But I guess some people needed clarity to a degree.
Great. Annie, does that sound like how RFP process with committees like the one the COA is now going to be engaging with going onward? Is that's the typical RFP review process with a committee?
No, I think that's not going to be typical because we have that committee that was set up in the framework. And so I would say that the typical process is probably going to be more similar to how the oversight advisory for the CMH millage. It's a lot more detailed.
Gotcha.
Yeah, it's not. I think we were trying to get money out fast.
Yeah.
And we were scrambling to get people in the mix to help score. So no, I don't think that's going to be typical. I mean, normally we don't have people from the Commission on Aging scoring RFPs. So that's like the first thing that's not typical, but we were also trying to rush to get this money out.
Yeah. just as these members continue to engage in the process, it's just helpful to hear what to expect.
That makes sense.
Mhm. All right, well, we can move on to the report from Annie on the Board of Commissioners. She does have results from this past board meeting and some of the transportation things. And then, so you want to share that and then anything else?
Yeah.
There
I
she
don't have much
is.
to say. Sorry, I was in transit. I'm actually at the county admin building.
There she is.
I don't really know what to say other than I continue to be deeply frustrated at the lack of understanding of the full board on how urgent it is to get money out to organizations. And I mean that in the most respectful way possible to my colleagues. But we did vote on funding for one organization at our board meeting. Um, I'm
And the other
excited for the
two are
Director of Aging
delayed.
Services. Yeah. I'm excited to hire a director where that process is being worked through. I chose not to be part of that process because I felt like my presence and involvement in some of this stuff made it worse for some reason. I have a lot of thoughts on why, but I decided to take a step back and let other people um, be more involved in the mix since there were many challenges with how involved I got with the framework. So I'm just kind of waiting. I've heard some good feedback about the interviews. And yeah, I'm excited. I'm hoping once we have that director, some of the chaos and lack of clarity in the public conversations we're having will not continue because at this point it's starting to get really frustrating and quite frankly embarrassing. So that's my update.
Anyone have questions for Annie? Bruce? Then
Uh,
Elizabeth.
I appreciate your honesty, Annie. And as somebody said earlier, all your efforts, especially on behalf of the older adults. The question I have is really around I mean, our subcommittee around the millage had shared a lot of information with the Board of Commissioners, and I think they went over much of it. There's still there's still a lack of clarity on some of the recommendations we made for what we thought were some good ways that we could continue to be part of and supportive to, and even help shape the processes going forward. So I'm hoping that particularly once the director is on board, we can return to some of those recommendations we made, because I think we do, as a group, really want to be as involved and as helpful as possible. And we had some specifics Marta, I think, shared with Marie, and then Marie passed them on. And I think it was some very thoughtful suggestions we had. So that's one point. The question I had was with regard to the hiring of the new director. Is there I think we had also hoped that we would have maybe some voice in, if they got it down to final one or two or final couple of candidates, that we might have some ability. And I know there was some concerns about privacy issues, but somebody on our committee mentioned that through many interview processes, it seems like there's ways to both have input and respect the privacy. So is there any anticipation that members of, or the COA as a group might be able to have a voice in the final selection?
I expressed the feedback from the last Commission on Aging meeting to the county administrator who controls, it's his responsibility to do all the hiring for the county. I don't know. I have not been included or gotten updates on who's on the committee. I know the commissioners that are on the committee and that's it. I don't know about any of the other staff, unfortunately.
Can we ask which commissioners, or is that confidential?
Um, I mean, I mean, it's not confidential because there's people on this. Well, yeah, it's not
Well, that's
me.
okay. Don't that.
So
Never
yeah,
mind.
yeah.
I don't want to put you on the spot,
Yeah,
but
I
it'd
don't
be
know. Like, I guess
nice.
I would have to ask them. I mean, technically, like anything that we do is foiable. So you
Oh, I
could.
did.
Oh,
No, I was
Jennifer
just
Green.
wondering.
Sorry, Jennifer Green is on the review committee from Ypsilanti. So we do have a commission on aging member present. And then we have a handful of commissioners. And honestly, I mean, it's fine. I'll just share it because it's foiable. So Commissioner Sanders, Light, Hodge, and Maciejewski. So we've got representation from kind of all of the ends of the county. Majority, actually, we've got 2 commissioners from like the kind of like far east, one that represents a more rural part, and then Commissioner Sanders has like the core, like Pittsfield, like center part of the county, and then Maciejewski Western. So it's pretty good representation across the board, both in urban and rural and suburban, I think. And I trust that they'll do a good job.
Okay, good.
Elizabeth?
I just wanted to say again, thank you, Annie, for your involvement. I think it's a sign of the tremendous trust we have in our relationship with you, that we're open and direct, expressing our opinions. And I hope you hear that as a compliment, which it really, really is. A lot of times in government, um, people don't have anything but superficial conversations with their governmental representatives, and their governmental representatives don't feel comfortable getting into the deep issues. So I mean this very sincerely. We really, I know I do, and I'm sure I speak for everybody else,
You sure
really
do. You
appreciate
speak for me too.
your
Yes.
participation and willingness to listen to all of us and everything we say.
Very well said,
Thanks.
Elizabeth. Thank you.
Thanks. I try to be honest and direct and not hold back my thoughts and feelings too. So
You do a good job, lady.
Yeah.
Great. Any other questions, comments?
Yeah, I have a comment.
Yep.
I want to say thank you, Marta. We finally met with People's Express, and it looks very good for us. The township, my township.
That's exciting.
Is she there? Are you there, Marta?
Yeah, Marta's there. She gave a thumbs up.
Oh, okay.
Mm-hmm. All right, so report from the chair. I don't have any additional things to report at this time. I will say that for October, we have Ageways coming to present on their most recent community needs assessment for Washtenaw County seniors. And then in November, I'm trying to get the group that did the Washtenaw housing study to come talk to us about the results of that study, especially as it relates to seniors. There was some very interesting things that they found and suggest. And one of that was more senior housing. But during the webinar, he didn't get in much to that specifically.
So that's
And then
coming in October, Marie?
October will be Ageways and
Okay.
the community needs assessment.
Okay.
Mm-hmm.
Okay.
November is hopefully the Washtenaw housing study.
Okay.
And then in December, we'll focus our time on the annual report.
Okay.
Mm-hmm.
Thank you.
Yeah. Any new business anyone wants to lift up? All right, our next meeting is October 3rd. Motion to adjourn.
So move.
Second.
Come on, somebody second it so we can go.
Phyllis raised her hand first. So
Come on,
Phyllis,
come on, come
great. Thumbs up.
Just a reminder that the officers will stay on to meet.
on.
Yep.
Okay. Thank you, Marta. There you are. Okay.
I've been here all along.
Okay. Have a good weekend, everyone.
You too. Bye.
Bye-bye.
I think Dina's still there we go.
I think she probably stepped away. I just removed her
Yeah.
manually.
Yeah.
We
And
can
I don't know
stop
what
the
happened.
recording.
I don't know what happened to Jennifer Green, whether she's okay.
Yeah, can you stop the recording and then we can talk
Yes,
more?
yes, yes.